Go ahead, ma'am.
Good afternoon, everyone. I'm Dr. Keerthana, fertility specialist and consultant at Oasis Fertility, Tolichowki branch. Welcome to today's Facebook Live session. And today's topic for discussion is unexplained infertility, which is basically defined as absence of identifiable cause for infertility. So, in other words, it is diagnosis of exclusion wherein evaluation would typically include demonstration of at least one patent fallopian tube, documentation of ovulation, and semen analysis with an adequate number of motile sperms for the male partner. That is a concentration of at least 16 million per ml and a progressive motility of 30% with a morphology of around 4%. So, now what is the incidence of unexplained infertility? So, it is usually seen in about 30% among infertile population. So, as just discussed, diagnosis of unexplained infertility is ruled out as long as the ovulation is confirmed, the tubal patency has been proven, and the semen analysis is normal. But you should always remember that even if the ovulation is confirmed, normal ovulating women may produce poor quality oocytes and embryos. So, even though the tubal patency has been proven, patent fallopian tubes do not necessarily function normally. And semen analysis is normal, but fertilization potential of a sperm can be affected. So, this all contributes to what is called as the unexplained infertility, which we would discuss in detail in the subsequent slides. So, coming to the what are the reasons for this unexplained infertility? What is the etiology behind it? If we look at the causes can be divided as male unexplained infertility as well as a female unexplained infertility. So, in male unexplained infertility, the most important thing that we have to understand is the advanced paternal age. So, uh, advanced paternal age, that is above 45 years, or with increasing age in a male partner, there is production of the germ cells which has increased DNA damage that contributes to unexplained infertility. And next, coming to what is called as the lifestyle factors that are responsible for unexplained infertility. The lifestyle factors, which include exposure or the men working at higher temperatures, obesity, sedentary lifestyle, consumption of alcohol, tobacco consumption, use of recreational or illicit drugs, caffeine intake more than 200 milligrams per day, or 2 cups of coffee in a day, and diet not consuming the Mediterranean type of diet. All these will lead to some changes in the Leydig cell, because of which the testosterone production is decreased, as well as the function of the Sertoli cells and the seminiferous tubules will be affected, which will lead to the altered spermatogenesis, ultimately leading to the decreased sperm concentration, motility, morphology, as well as the sperm viability. So, after the lifestyle factors, next important thing that contributes to unexplained infertility is this oxidative stress. So, normally in a redox balance, in a normal male, the oxidation and the reduction phenomenon is balanced, and there is not of much oxidative stress. But if there are some risk factors like genitourinary tract infection, or there's smoking or industrial exposure, or there's some malignant condition, or in case of some systemic diseases like hypertension, diabetes, or exposure to radiotherapy, chemotherapy, excessive heat exposure, or in conditions like varicocele, this balance is shifted towards more of the oxidation, because of which there is generation of reactive oxygen species, and that is responsible for the oxidative stress. And the seminal plasma usually contains antioxidants, which balances this oxidative stress. But if the this ROS production is in excess, that the balance is not maintained, then it leads to the impaired environment in which the sperm production occurs. So thereby leading to what is called as a unexplained infertility. So after oxidative stress, next comes what is called as the immune infertility. That is, this immune infertility. So in immune infertility, because of the production of what is called as anti-sperm antibodies, which these antibodies usually they appear because there is any developmental abnormality, or there is a breach in what is called as a blood testis barrier because of trauma or because of infection or any obstructive pathology. There is production of these anti-sperm antibodies, which will decrease the sperm motility, cause sperm agglutination, and impaired ability of the sperm to penetrate the cervical mucus. And it also, these anti-sperm antibodies, they also tend to have deleterious effects on the important fertilization events like capacitation, acrosomal reaction, and the sperm egg interaction. So after the immune infertility, we have the sperm DNA damage because of the varicocele, aging, diabetes. The chromatin inside the sperm gets fragmented because of these risk factors, and men with elevated sperm DNA damage, they also take the time to pregnancy in these men is something that gets prolonged. And after the sperm DNA damage, then we have these coital factors that because of the inappropriate timing of the intercourse or erectile dysfunction or anejaculation. Next, after male unexplained infertility, we have what is called as a female unexplained infertility, and some of the listed reasons in a female that will contribute to the unexplained infertility include again the lifestyle factors as discussed. So, in a female, uh, because of the improper eating habits and the nutritional insufficiency or obesity, or because of disturbed circadian rhythm, smoking, alcohol consumption, or intake of recreational drugs, exposure to chemicals, pesticides, electromagnetic radiation, or because of sexually transmitted infections. These are all the risk factors, or some of the changes in the lifestyle that are a contributory factor for the unexplained infertility. And after the lifestyle factors, we have what is called as this subtle ovulatory disorders. What is a subtle ovulatory disorder? It is nothing but it can be an anovulation or an inadequately timed ovulation, or ovulation of a follicle with decreased size in a woman with regular cycles. Certain ovulatory disorders are also one of the reason for the unexplained infertility in a female. And after that, it is the premature ovarian aging, which is closely related to a female age, and the fact that ovarian reserve in a female usually decreases with age. So this ovarian aging will lead to what is called as a poor ovarian response and poor follicular growth that contributes to unexplained infertility. And after this premature ovarian aging, it's the oocyte quality again, which is primarily related to a female age. And tests to measure the oocyte quality or the oocyte number include the age of the female and the measurement of follicular stimulating hormone and measurement of anti-Mullerian hormone and the look and the demonstration of the antral follicle count during the ultrasound. And when it comes to undiagnosed tubal factors, so it is not only that the patency of the fallopian tube alone is sufficient for a fertility, but the tubal movement and the internal milieu of the fallopian tube are also critical to the normal function and normal implantation. So, whenever there is disruption of the functional integrity of the fallopian tube, that contributes to the unexplained infertility. So, what are the reasons for this disruption of the functional integrity of the tube? Is that it can be triggered by smoking, which causes a decrease in the tubal motility. Or there is an infection or history of a previous pelvic inflammatory disease, which is usually caused by chlamydia trachomatis. With one episode of pelvic inflammatory disease, the tubal factor infertility risk increases by around 8%. And if there are previous two episodes of such PIDs, the tubal factor infertility risk increases by around 19%. And with three or more episodes, the risk increases close to 40%. So, after the undiagnosed tubal factors, let's look at what are the uterine cavity abnormalities that are responsible for unexplained infertility. So, in some women, any uterine synechia or mild cases of intrauterine adhesions or any chronic endometritis, uh, they are also responsible for the unexplained infertility. And in case of cervical factor, which includes any anatomical abnormality or because of the previous surgery, there is some scarring over the cervix, the normal cervical architecture is lost, or there is decrease in the production of the cervical mucus that prevents a natural progression of sperm into the uterus. These are the cervical factors that contribute to unexplained infertility. And the most important in a female is this endometriosis, which in some women wherein there is minimal to mild disease which is not picked up in ultrasound, it is also a dominant finding in women with unexplained infertility. And how does this endometriosis cause unexplained infertility? So, in endometriosis patients, because of these peritubal adhesions, there will be altered tubal motility, and because this endometriosis is also associated with peritoneal inflammation, so because of the toxic effects of these peritoneal inflammation on the oocyte, on the sperm quality, and because of the inflammation that is responsible for decreasing the endometrial receptivity. So these are all the mechanisms that are proven to cause that are proven to decrease the fertility chances in a woman with endometriosis. So, as discussed, because of the anatomical reasons, like because of these adhesions, the tubal motility will be altered, or because of the fimbrial blunting, clubbing, or at the fimbria get clubbed to each other, because of which there will be decrease in the movement of these fallopian tubes. So, the capture of the egg by the fallopian tube does not occur timely. Tubo-ovarian relationship will be disturbed because of these adhesions. And on the ovary, the effect of this endometrioma can be sometimes decrease in the oocyte quality, or there can be decrease in the number of the oocytes as such. And in case of sperm, they usually are supposed to cause decrease in the binding of the sperm to the oocyte, or can there can be an increase in the sperm DNA damage. When it comes to the uterus, there can be decrease in the endometrial receptivity because of the decreased expression of the important markers that are responsible for the implantation of the embryo. Along with that, the peritoneal inflammation, because of which there is elevated production of certain cytokines and chemokines that have a deleterious effect on the sperm and the oocyte quality as well. So after discussion about the etiology in terms of male and female unexplained infertility reasons, what are the investigations that can be done in a male, that can be done in a female in case of unexplained infertility? So if we look at the investigations in a male, the basic semen analysis, the first and the foremost important thing, and adding to the semen analysis is additional testing in terms of anti-sperm antibodies and testing for the reactive oxygen species and the DNA fragmentation index testing. Though these are not recommended, some are the laboratory tests that can be done to know the reason for the unexplained infertility. And in case of the female, the basic hormonal evaluation in terms of measurement of follicular stimulating hormone, the luteinizing hormone, anti-Mullerian hormone, measurement of TSH prolactin to know if there is any thyroid or prolactin disorder that is responsible for the unexplained infertility, and doing certain ovarian reserve tests in terms of AMH, AFC, and the measurement of follicular stimulating hormone. And to know if there is any uterine cavity abnormality, or to know the assessment of the cavity thing, we can do a transvaginal sonography or 3D ultrasound, or by doing what is called as a hysteroscopy. And to look at the tubal patency test is again the whether not only the function of the patency of the tube, it's also the functional integrity of the tube, which can be assessed by HSG or hysterosalpingo-contrast sonography or a laparoscopy. And finally, the ovulation test, to that is a follicular monitoring to measure the serial growth of the follicle, evidence of ovulation, or measurement of the serum progesterone levels. And after the investigations, so next, what are the treatment options that we have for unexplained infertility? So first and the foremost, the expectant management. So expectant management for about 6 to 12 months, that is the wait and watch policy in good prognosis patients, that is if a woman is less than 35-year-old, and the duration of infertility if it is less than 3 years. But if a woman is above 35 years and they are trying since more than 3 years or 5 years, then expectant management is not recommended in those people, and evaluation and immediate treatment has to be attempted. And after the expectant management is what is called as a ovarian stimulation or ovulation induction, and the timed intercourse cycle. The ovulation induction with some simple oral agents, it is usually not recommended as a treatment option for women with unexplained infertility, because it is not proven to help anything much more than the expected management. And next, ovulation induction or ovarian stimulation with some simple oral agents like clomiphene citrate or letrozole, and doing an intrauterine insemination is recommended as a first line treatment for couples with unexplained infertility. And in fact, intrauterine insemination with the ovarian stimulation, it results in a higher cumulative live birth rate compared to what is called as a expected management. So both the oral stimulating agents, clomiphene citrate or letrozole, are equally recommended. With gonadotropins, there is definitely an increase in the live birth rate, but equally important is the increase in the risk of multiple pregnancy. So unless and until there is a close follicular monitoring, the usage of the gonadotropins without monitoring should not be attempted. And last and the most important is the in vitro fertilization or the ICSI. So IVF is advised to the couples with unexplained infertility after they have at least 3 cycles of ovarian stimulation and intrauterine insemination that has not resulted in any pregnancy, or at least 3 cycles of ovarian stimulation, intrauterine insemination have failed. Couple is advised to go for IVF or ICSI. So when we look at IVF versus ovarian stimulation and IUI, intrauterine insemination, IVF results in a significantly higher live birth rate, but with comparable multiple pregnancy rate and the ovarian hyperstimulation. But if a woman is less than 38-year-old, there is no difference in the live birth rate. But in an advanced maternal age, or if the woman is above 38 years, live birth rate is significantly higher in the IVF group. So this is all about unexplained infertility, starting from the definition, what are the causes, what is the etiology, what is the incidence, and what is the evaluation that needs to be done in case of unexplained infertility in a male, in a female, and what are the treatment options. So if you have any questions, we can discuss. Will IVF work for unexplained infertility? Definitely, when we compare IVF with ovarian stimulation and intrauterine insemination, if the woman is above 38 years, IVF is the treatment of choice for increase in the live birth rate in a woman with unexplained infertility. But in a woman less than 38 years old, the live birth rate is equal either with the ovarian stimulation or an intrauterine insemination or an IVF. But after having had 3 cycles of ovarian stimulation and intrauterine insemination and still the pregnancy doesn't happen, IVF is definitely going to increase the live birth rate and decrease the time to pregnancy. So what is the first step for unexplained infertility is, if possible, we'll have to find out the reason, and if not, we can, if the age of the female partner is less than 35 years and the duration of infertility is less than 3 years, we can attempt ovarian stimulation with some simple oral agents and do an intrauterine insemination cycle, provided the tubes are open and the male has a normal semen analysis parameters and the woman is ovulating regularly or she has a regular menstrual cycle. How can I overcome unexplained infertility? Is again as discussed, depending upon the age of the woman, duration of the infertility, we have treatment options like expected management or ovarian stimulation and intrauterine insemination, or even if 3 cycles of intrauterine insemination didn't result in a pregnancy, is what we can go for. IVF or ICSI is the treatment of choice for unexplained infertility. Thank you.